Hi, everyone. This is chapter 6. We're going to be looking at um, bone and skeletal system anatomy. A lot of this is crossover with lab, so I'm not going to go into great depth, but a little quick review of the bones and the skeletal system. So there's going to be bone markings and surface features that you're going to want to learn on your own or in lab, and it's really just memorization. It'll be covered again in lab. You want to understand questions, and it's going to help you a little bit remember the different parts of the bones and understand what we're talking about. So bone markings are known as surface features, and they are related to the functions. So you've got elevations or projections. That would be where muscle, tendon, and ligament attach. So there's a little bit of pull or force on those bones. And so you're going to see elevations there, and you can also see it at joints where the bones articulate. And then you've also got depressions, grooves, and tunnels where blood vessels or nerves that are going to either run alongside the bone or penetrate into the bone. So in general, we've got the head of a bone, and that is at the proximal end, usually forming part of the joint. You've got your diaphysis, super important to know. It's the shaft of the bone, and then you also have the neck, and that can be a narrow connection between the head and diaphysis. So the femoral neck is the most common, hence we're looking at the femur here. We've got elevations or projections. So a process is any projection or bump. We've got tubercles. These are small rounded projections, or tuberosities, different from tubercles. Don't get them confused. And these are small rough projections that take up a broad area. On the humerus, you will be able to feel this deltoid tuberosity. It's hard to see, but when you run your finger down it or look closely, it's right there. You have a trochlea. That's a smooth, grooved articular process that looks like a pulley. And then you've got condyles, and these are smooth, rounded articular processes. We've got trochanters. These are big, rough projections, again, here on the femur, where you've got a big attachment. And then you've got facets, which are smaller, and they're relatively flat articular surfaces. You have crests. So here is the iliac crest. This is a really prominent ridge. You have lines that are a little bit lower of a ridge and more delicate. You've got a spine, which is a pointed or narrow process. You can think of like a spine on a stegosaurus. And you have a ramus, or multiple are known as like a rami, and these are extensions of a bone that makes an angle with the rest of the structure. Then we've got our depressions. We've got canals, or a meatus, which is a large passageway through a bone. So here is a canal towards the back of this orbit. You've got a sinus, which is a chamber within a bone, usually filled with air. You have foramen, which is a small rounded passageway for a blood vessel or nerve to pass through. You've got fissures, which are an elongated cleft or gap. You may have heard people talk about fissures in the earth after an earthquake, big kind of rough area. You've got a sulcus, which is a deep or narrow groove. And then you've got a fossa, which is a shallow depression or a recession in bone. Fossa is related to the word for like little hole. So you've got just a shallow depression. So chapter 7, this is lots of content covered in lab, but we'll look through it briefly and gives us an idea of what we need to know for the lecture. So you are responsible for all of the bones, the landmarks, and the content from labs. You need to know all 206 bones, and you need to know what part of the skeleton they fit into, what region. So is it a skull bone, a facial bone, arm, leg, pectoral girdle, pelvic girdle, etc. What's the different functions between the axial and appendicular skeleton? Definitely the curves and regions of the vertebral column. And remember, bones look different depending on perspective. Your textbook has good images, visible body has good images. Don't forget to handle the bones in lab. I can't tell you how much and how frustrating it is when you learn them on only one image. And then every other time in your life, they're not that other image, and you're not going to be able to understand them. So you really have to get a 3D model. So we're looking here at the axial skeleton. So that includes our skull, our thoracic cage, and our vertebral column. And I guess the associated bones of the skull are included as well. And then we have our appendicular skeleton, and that's the pectoral girdles, the upper limbs, the pelvic girdles, and the lower limbs. So you want to know which bone fits in which category. So the axial skeleton's functions are to support and protect the brain, spinal cord, and organs in the body. It's going to provide an attachment site for certain muscles, specifically those that adjust the position of the head, neck, and trunk, or perform respiratory movements, or stabilize parts of the appendicular skeleton. And there are some joints there. They're not the joints that we think of with lots of movement, but they are very strong. And remember, a joint is really just where two bones come together. So when we look at the skull, we've got the associated bones. So the associated bones are the hyoid bone and then our auditory ossicles. And then the skull is divided into the face and the cranium. The cranium is what's going to be holding the brain. You can think of the game Cranium, which has that brain on the box. Your cranium is made up of 8 bones. You have 1 occipital bone, 2 parietal bones, 1 frontal bone, 2 temporal bones, 1 sphenoid bone, and 1 ethmoid bone. And then the face, again, is what you might think of as the face of someone when you're looking at them. You have your 2 maxilla, you've got palatine bones, you've got nasal bones, you've got your inferior nasal concha, you've got zygomatic bones, lacrimal bones, your vomer, and your mandible. So here we are looking at the skull from an anterior view, reviewing these facial bones. So your paired bones, you've got your nasal bones, tells you where they are. Your lacrimal bone is here at the inner corner of your eye. Lacrimal is related to the word for crying. And so, you know, your tears flow down from the inner corner of your eye, helps me remember the lacrimal bone. You've got your palatine bones. They form your hard palate in your mouth, but it peaks up here in the back of the orbit. Your zygomatic bone, that's usually your cheekbone here. It's got some processes you'll see. You have your maxilla. I always remember that there could be a guy called Max that has a mustache, and that mustache would go in his maxilla. You've got your inferior nasal concha, which we'll learn a little bit more about in AP2. You have your vomer. That's the tiny little bone here, not paired, it's a single bone at the ventral portion of the nose, and then your mandible, that's your lower jaw. The cranial bones around the skull, you have your paired parietal bones, your frontal bone, which is your forehead, your sphenoid bone. This bone is butterfly shaped and appears sort of everywhere when you look at the skull. So definitely look at 3D models to get an idea of your sphenoid bone. And then you have your ethmoid bone that we'll see here peeking out in the orbit, but that's also part of what the brain is resting on. So a view, we've now got a sagittal section. Here is that frontal bone, parietal bone, occipital bone. We have the temporal bone here. And then here is our sphenoid bone. We've got the little butterfly wing peeking out. The nasal bone, and here is the vomer, just coming up ventrally or inferiorly in the nose. Your palatine bone, here at the back of your palate. You've got your maxilla and your mandible. Here is your ethmoid bone as well, and you have some sinuses. We want to be aware of the hypophyseal fossa, where the pituitary gland sits, and the sella turcica. We want to know about the internal acoustic meatus, which is in that temporal bone where things from the ear go, and then that hypoglossal canal in the occipital bone. Don't forget about your pointy styloid process. Styloid looks like a pen or a stylus, really great for orienting yourself when you're looking at a skull. On the skull, we want to know some openings or some foramina, specifically the foramen magnum, the big foramen, which is where your spinal cord joins your brain. You've got the occipital condyles, which is where your spinal cord will articulate with your skull. We want to know about some of the sutures. So we've got the lambdoid suture peeking out right here. There is our styloid process, that pokey part that's in the temporal bone. And you can see near that styloid process is your mandibular fossa. That's where your mandible is going to sit. You can see you'll have your mastoid process back here as well. That's more rounded and less sharp and protuberance. And then you can see these openings. I think it's helpful to know your foramen lacerum. Lacerum, like a laceration. So even though it's a foramen, it's kind of long and like it would be with a laceration. You've got your jugular foramen, which is just posterior to that styloid process. You've got your carotid canal, narrower than that jugular foramen. And then you also have your stylomastoid foramen right between your styloid process and your mastoid process. So helpful to identify those. And another foramen to be aware of, you've got your foramen ovale, which is here in your sphenoid bone. So note lots of foramen in the temporal bone and the sphenoid bone. Note that your jugular foramen and foramen lacerum are near the occipital bone as well. So keep those in mind. This is the orbit. You want to know the bones of the orbit. Super important. Here we have the sphenoid bone. We have our, and if we notice, this is the zygomatic bone, so we know that is lateral. So this is medial. We have the zygomatic bone. We've got our maxilla. We've got our lacrimal bone here. We have the ethmoid bone. We've got a little bit of the palatine bone sneaking up right here. And here is our temporal bone. So know those bones. You've got your supraorbital margin and your supraorbital notch. So there's a notch here. You have your nasolacrimal canal, which is where your tears drain from the ocular system into your nose, which is why your nose runs when you cry. And you've got your infraorbital foramen. This one is pretty significant for numbing things in the eye area. So sinuses, be aware of those sinuses, your maxillary sinuses in your maxilla, your frontal sinuses in your frontal bone. You've got paired sphenoid sinuses in your sphenoid bone. And then you've got some ethmoidal air cells as well. So be aware of those sinuses. Those are going to be significant. Looking at spinal curves and looking at the vertebral regions. So know how many vertebrae in each region. You have 7 cervical vertebrae, you have 12 thoracic vertebrae, 5 lumbar vertebrae, 1 sacrum, and then your coccygeal vertebrae. And then each area has a curve. You want to know which way the spinal curve goes. So does it curve more anterior or does it curve more posterior? So your cervical curve, this develops after birth. You've got your thoracic curve that is developed during birth. Your lumbar curve develops after birth, but your sacral curve is present in utero. So know which ones develop before and after birth. Looking at the vertebral arch, we have our inferior view. So a few things to note. You've got this vertebral foramen. That's where your spinal cord is going to go through. You have your vertebral body, which is the place where your intervertebral disc is going to be. You have your arch here, arches over the foramen. You will have a transverse process that will protrude laterally from that vertebra. And then you'll have various facets depending on the location of those vertebra. You want to know the spinous process that pokes. In this case, it looks like it's poking up, but when you place it in situ, it's going to either poke posteriorly or maybe even inferiorly. You've got your lamina, that connect your spinous process to those transverse processes, and then your pedicles connect your transverse process to the vertebral body. So be aware of those. You want to be able to look at a vertebra and know what part of the spine it belongs to. Few little tips and tricks. If it's a cervical vertebra, it has this bifid spinous process, so the spinous process will divide. And then it's also going to have these transverse foramen, which is where important arteries are going to flow through. So look for those foramen, look for the spinous process here. They're going to be relatively small. Few other points, the thoracic vertebra, the spinous processes are going to point inferiorly. The vertebral bodies, they're not going to be huge. They're going to be kind of heart-shaped, not completely round. And they're going to have some places for rib articulations. And then your lumbar vertebra, they are going to be giant vertebral body, very flat. You're going to have very small vertebral foramen. The spinous process is now pointing posteriorly. It's not pointing inferiorly anymore. And you've got really short transverse processes. So keep in mind how you're going to differentiate those. Here is your sacrum and your coccyx. Important to attach the axial skeleton to the appendicular skeleton. You have your base, which is wide. Your apex is narrow, and you have your ala, that comes from the word for wings. You have a sacral promontory here, and then sacral foramina as well, that are openings. Looking at your ribs, know if it's a true rib or if it's not a true rib, a false rib. Your vertebral sternal ribs or your true ribs are ribs 1 through 7. They attach to the sternum. Your vertebral chondral ribs are ribs 8 through 10. They don't attach directly to the sternum, but they have cartilage that will attach them to the other ribs. And then your vertebral ribs or floating ribs are ribs 11 and 12. You've got your costal cartilages, costal meaning having to do with the ribs. And then here you've got your manubrium, your body, and the xiphoid process of your sternum. That xiphoid's where you want to push if someone's choking for your Heimlich maneuver. Here we've got the appendicular skeleton. So we finished the axial skeleton where we have limbs, the pectoral and pelvic girdle, and then function's going to be for movement. So here we're looking at the pectoral girdle. That's what's going to attach the arm to the axial skeleton. And really that main attachment is here at the sternoclavicular joint, where the clavicle and the sternum join. You want to be able to see that the lateral end of the clavicle is a little bit wider. It's called the acromial end because it's going to articulate with the acromion of the scapula. The medial end is not quite as wide and a little more flat. So be aware of the clavicle. And then you can also see there's on the inferior surface, it's a little bit less, you've got this little bit of kind of a groove where it's a little bit more irregular, so you can identify which is the superior and which is the inferior face. Here is our scapula. Definitely know, is it the acromial process or is it the coracoid process? And make sure you say coracoid and not coronoid. You've got your lateral border, your medial border, and the superior angle. Notice this is an anterior view, so we're looking at the left scapula almost through the ribs, and then you've got your subscapular fossa here as well. Here is our femur with a few highlights located. head of the femur. We've got a greater and lesser tubercle based on size. There's that deltoid tuberosity, that's rough. And then at the distal end, we have our capitulum, which is this rounded area. It's going to be more laterally. We've got our lateral epicondyle and our medial epicondyle. We have the trochlea here. We can see it on the posterior view as well. Trochlea, remember, related to pulley. You have your olecranon fossa, where the olecranon of the ulna is going to go. And then you have your coronoid fossa, where your coronoid process of the ulna is going to go. So be aware of those areas. Here we've got our radius and ulna. We've got a posterior view. There's that olecranon, which is your elbow. Your ulna has a little styloid process that's going to come out inferiorly, and then your radius also has a styloid process as well. The radius and ulna fit together at the ulnar notch. You have an interosseous membrane of fibrous tissue between the radius and the ulna. Your ulna, you have your coronoid, notice it's got an N in it, process on the anterior surface. You've got your trochlear notch that's going to articulate with the trochlea. And then here's the head of the radius, which is more proximal. Excuse me. Here we go, looking at our carpus. You want to know the bones of the carpus. So your scaphoid, your lunate, your triquetrum, and then here's your pisiform bone. And then you have your trapezium, your trapezoid, your capitate, and your hamate bone. Remember the mnemonics from lab. Here are your phalanges. We want to know that they're numbered from medial to, they're numbered from lateral to medial. So from the hallux and then over to the fifth metacarpal bone. Remember, you've got your metacarpals, your proximal, middle, and distal phalanges. Looking at our hips, be aware of your iliac crest. That's that wing that you can see. We've got our sacroiliac joint and our pubic, on this side as well. And then here's that pubic symphysis. Your ilium is that bone with the wing. Your ischium is your tailbone. And then your pubis is in that pubic area. Don't forget your acetabulum, super important. That's where your femur is going to sit. And then here's your obturator foramen. So it is a big foramen that you're seeing. Excuse me. Notice the difference between the male and the female pelvis. You want to be able to put on your CSI hat to identify if the remains are from a male or female. Helpful highlights: the pubic angle in the male pelvis is narrower than the female pelvis. Again, the females need a much wider pelvic outlet to have birth through, versus the males, it is more narrow. The coccyx for males will point anteriorly, versus for females, it will point inferiorly, again, making that pelvic opening larger. And then notice for the males, the ilium is more vertical, versus for females, it is a little bit less vertical and extends less superior to that sacral articulation as well. So those are a couple of highlights for differentiating, is it a male or is it a female pelvis? Here we go for the femur. We've got our femoral head, which goes in the acetabulum. We have a greater trochanter and a lesser trochanter. This is the neck of the femur. Super important as a surgical site for hip replacements and for other surgeries. We have the linea aspera, which runs down this femur that you can feel as you put your fingers on it. We have a lateral condyle on the distal end, and we have a medial condyle as well to be aware of. Tibia and fibula. Remember, fibula's got the L in it. Fibula is lateral because it has the L in it. Fibula is the small bone, so it looks trying to fib that it's a big bone. Keep track of those. Don't misspell them. Don't get them messed up. So the fibula has a head, and then distally, we've got the lateral malleolus because it is laterally on the body. Tibia, we've got the big tibial tuberosity. There's an intraosseous membrane here, and then we have the medial malleolus on the tibia. So know which one is on which bone, which malleolus. Here we go for the ankle or the tarsus. Bones, we have the trochlea. It's again kind of rounded here. The calcaneus, which is our heel bone. We've got the navicular bone here and the cuboid bone here, and then our three cuneiform bones. Again, we have metatarsals numbered 1 through 5. In this case, we're going to start medial with the hallux. We've got a proximal, middle, and distal phalange. In our metatarsals or in our digits 2 to 5, but remember, in both the hallux and the pollux, there's only 2 phalanges. So we'll make a new video for chapter 8 on joints, but you can spend some time reviewing your anatomy of the bones. Thanks so much. Bye.